economic situation here. So we're following that in real time, staying very close to D.C., but at the same time, as the governor mentioned, we're not waiting for D.C. Secretary McCaw and myself with Chief of Staff Mounds have been in dialogue with legislative leadership about what the state of Connecticut can be doing and should be doing on the relief front. So we're going to be doing that concurrently while paying attention to D.C., making sure that we're taking legislative action and providing help to the citizens and small businesses of Connecticut. So with that, I'm going to stop, and we're all happy to take any questions.
I believe that whatever we're going to do in association with our fellow governors. But right now, it does seem to me that a lot of malls have big areas where folks can congregate, and they could be at some risk there. So it's something we're going to take a look at.
Governor, when we would be making a decision on the April 15th tax deadline, which frankly affects everybody, if it goes to July 15th, that would be throwing the money into the next fiscal year. Is that a problem? Is that an issue? Is that part of your consideration here?
Somebody's coming to help me.
Very good. We are following the federal guidelines. We don't expect our personal tax withholding to be impacted. That's the amount that comes out of our paychecks on a weekly or biweekly basis. So it's only those that do not have income withheld from their paychecks. That's a much smaller impact to the state of Connecticut for that extension. So as of right now, the area we're really focused on is the personal income tax withholding, and that in terms of filing and payment of those taxes will not be impacted.
Governor, do you plan on signing any sort of executive order that would allow the private labs who are doing these tests to report the negative results that they get? They can only report the positive results.
Want to talk about that, Dr. Carter?
In terms of disease reporting from laboratories, we already get electronic laboratory reporting from all of these laboratories. We collect information on people who are sick and who test positive for diseases. This is true for all diseases, not just COVID-19. We could do that for labs that report to us electronically, and that would provide us with some useful information. But it's important to remember that testing is important, but it's not what's going to get us through this. It's just one of the tools that we have, and it's our individual actions that are going to make a difference here. The vast majority of people who get this illness will not get very sick. They might think they have a mild cold, feel a little achy, not quite normal, and be better in a few days. They don't need to be tested. The test also isn't useful for people who are not sick. It's not a screening test to see if you might have it. Right now we're using the test to keep our acute care hospitals open. The purpose for these testing sites that we've set up, we've picked acute care hospitals to do this because it was necessary to set these alternate spaces or sites up where samples could be taken that's not in the emergency department, because our EDs were being overwhelmed with people. And so this was really to have a place so people don't have to go to the emergency department to be tested. And most of us will not need to be tested. It's right now, testing capacity is increasing every single day. The major thing that's actually holding it back is the fact that getting samples taken is still a challenge, because you need personal protective equipment, and personal protective equipment that they do not have in doctors' offices. So one of the things that we look at when we, for example, we do have negative test results from the state laboratory, that the most important thing is not the number of tests, but the percentage of tests that are positive. That's the key. And for example, we've done, just give you the exact number from the state laboratory, 248 tests so far. 222 of them have been negative, just 26 positive. Well, that's still a very low percentage. It won't be long before we start seeing 40 to 50% of those tests being positive. That's what we're looking for, an increase in positivity rate. This happens every year. We do this with influenza as well. I know you may be getting different messages when you turn on the TV at night, because I think, what was it, the head of WHO said the answer to this is testing, testing, testing. Testing is important, but it's not the answer. And we need to use all the tools that we have to use testing to identify where we need to take public health actions at hospitals and others to slow the spread of this disease down. Right now, not far away from us in Greenwich, Connecticut, in Greenwich Hospital, they're working 24/7. The doctors and nurses and others haven't been sleeping for days. They're totally full. Same thing in Danbury and in Bridgeport Hospital. We now have cases in Hartford and New Haven. And really, this is just starting to move across. We're just at the beginning of this. We continue to support all the testing needs of our acute care hospitals. Yale New Haven Hospital is now online with testing, and we expect to have other testing sources available for our other acute care hospitals as well. They need these test results in order to be able to manage patients and stay open. So there are two other numbers that are much more important than the number of tests that are done. One, the number of people who've been hospitalized with COVID-19, and the second is the number of people who have died from COVID-19. Those will be the things that drive decision-making in Connecticut, and testing will support those things, but those are the two most important.
Do you mean how many people are hospitalized right now?
It's probably at least 26, but now, but that number is going to grow larger. And I'd also like to point out that this happens every year with influenza. And I know some people a week ago heard me say that 10 to 20% of our population gets sick from influenza every year. And I did get some emails questioning my ability to do math afterwards. But it's true, we do. We don't test everybody. But we know that for every person who tests positive for flu, there's probably 100 others out there who've been sick with the flu who never get tested. And right now, if we have 68 positives, you should assume that there's at least 100 people out there who have COVID-19 for every single positive, which puts us around 6,000 or so, and that might be a low estimate.
Doctor, specifically on Eastern Connecticut, the governor said a second ago we've had very, very few
Well,
cases there.
and this is, yeah.
Is the real reason that there hasn't been much testing going on there?
No.
What is the real reason?
The real reason is there hasn't been people who are sick and diagnosed with symptoms of COVID-19 in hospitals in the eastern half of the state. Because we've been testing every single person admitted to a hospital, whether it's in the western part of the state or the eastern part of the state, who have the symptoms of COVID-19. We are getting samples submitted from the eastern part of the state, and they have all been negative. I mean, all of us are experiencing something that none of us have ever experienced before. I mean, last week, I think on Thursday, there were 6 confirmed cases. Now there are 68. Many more people have COVID-19 than just the 68. This is the tip of the iceberg. And we don't have a good measure of below because there are many more people who have mild symptoms. But the people that we are focused on right now are the people who are most seriously ill and require hospitalization. That we can measure, and we'll make estimates for how big that iceberg is as we move along.
Do we know how many hospital beds we have right now and how many you will need when this thing?
Somebody else want to answer that question? I don't have it.
We know we have about 9,000 hospital beds in the state. The modeling around how many we think we need, we know the Hospital Association's working on that, and we're supporting that. But really, we're taking actions now, and our hospital network is taking actions now to look at every opportunity, as the governor mentioned before, to postpone surgeries that can be postponed, conserve PPE. That's really the most important thing right now. Conserve PPE, conserve rooms, conserve staff to prepare for that, and look at all the other options the governor mentioned as well in terms of alternate sites for step-down capacity for people who are diagnosed who have to be hospitalized but then need to go somewhere to recover that maybe they don't have a home or they don't have somewhere to go to. So we're looking at all of these contingency plans, really focused on planning for a significant need in the coming weeks.
And any indication on when it will peak? New York was saying 45 days.
The only thing we have to draw on is that there have been, on average, 3 influenza pandemics every century. And influenza pandemics usually come in waves. There's this, for example, in 1918, there was a spring wave, a fall wave, and another spring wave. In 2009, the H1N1 influenza pandemic we all experienced. It started in April and May and June and disappeared over the summer and came back in October, November, December. So for influenza, it's usually 6 to 8 weeks. None of us have experienced a coronavirus pandemic before. So we really don't know. We're trying to draw on the influenza experience, but to be honest, we don't know if this is going to act just like influenza or not.
Has there been any discussion about rent or mortgage relief?
So yes, it is something that we're considering and discussing how to enact that and what is the best way to do that. So stay tuned on that.
Governor, are you considering more drastic measures? It may be premature, but I'll ask anyway. San Francisco type things. New York City's been talking about shelter in place. Obviously, there have been more drastic measures than what Connecticut has done so far. Where are we on that?
Yeah, and what would it look like?
I think the answer to that is not yet. I'll tell you why. I mean, we've been working with our mayors. We've been working with our superintendents. We asked, it's probably appropriate to not have a St. Patrick's Day parade. They stepped up. We talked to our superintendents of schools, said I think closing the schools makes sense. They stepped up. We had to work hard with our restaurants and the such, and they stepped up in the bars and did what we have to do. And so I think the people of Connecticut understand the scope of what we're confronting, and on a voluntary basis, they're stepping up and doing the right thing. I've got to urge yet again before closing, everybody over the age of 60, everybody over the age of 70, stay in your home. You are most vulnerable. I'm staying right here as much as I humanly can. And to young people, when you talk about what could be happening, I know sometimes we feel like we're can't be stopped, but it's really important for you to stay close to home. That's why we had to close down the bars. That's why we had to close down the restaurants. They were busy as early as Saturday and Sunday night. And but I think what you're seeing right now, Chris, is people stepping up and doing the right thing. And I got to urge you, it's serious, and you can make an enormous difference if you follow that maxim.
Mr. Governor, have you spoken to Governor Cuomo about his call for the Army Corps of Engineers to build a lot more hospital space? He's calling on the federal government to do that, and the federal government so far hasn't responded to that.
We've talked about that a little bit. Our team is looking at facilities when it comes to university dorms, when it comes to hotel space. We think we've got enough capacity, but we are thinking a little bit about some of the outside MASH type units where easier drive-by in clinics. So, but at this point, I don't think there's a real need.
All right. What about ventilators?
We're working with the hospitals every day to do everything we can to source every ventilator we can. Obviously, we need more, and we're going to do everything we can to get more. Thank you, everybody.
Thank you.
You have been watching live coverage of Governor Lamont updating the state on the coronavirus situation here in our state. He is at the executive residence where he and Mrs. Lamont live in Hartford's West End. He was joined by some of his commissioners and fellow aides. Good evening and thanks for joining us. I'm Dennis House. It is being called the tip of the iceberg, with 27 Connecticut residents testing positive for coronavirus since yesterday. There are now 68 cases, according to the governor, 48 in Fairfield County, 7 in Hartford County, 8 in New Haven, and 5 in Litchfield. Nothing yet in Middlesex, Windham, Tolland, or New London counties. The governor also announced help is on the way for those out of work during all of this. 10,000 applications for unemployment were filed yesterday alone. Right now, we have a total of 40,000 on unemployment across the state. We'll have much more on this a little bit later on. Now, New Haven County would include the city of Waterbury, now having their first case of coronavirus. And today, Mayor Neil O'Leary declared a state of emergency in the Brass City and delivered an urgent message for residents. Channel 3 Eyewitness News reporter Courtney Zeller is live now in the Brass City with more on what they want people to know. Courtney?
Hi, Dennis. We talked to the mayor earlier today. He says the biggest issue facing Waterbury is trying to get residents to understand that this is real. He also says it's a huge health issue, and we found some people who weren't heeding that warning today. A wedding celebration inside Waterbury City Hall. While a wonderful time in a couple's life, right now might not be that perfect time.
We got engaged last year, so we set a date for the 17th of March, and it happens to be this pandemic, so we just went ahead and did it.
The couple says it's their 7th anniversary today. But with coronavirus fears and positive tests increasing daily, the president and local leaders are urging people to take this global pandemic seriously.
You could see you just saw people downstairs in our lobby, 50 of them, celebrating a wedding celebration, and none of them were practicing the social distance related issues.
That distance is at least 6 feet away from another person. An important reminder as Waterbury had their first positive test yesterday. A woman in her late 20s tested positive for coronavirus. She returned from northern Italy with her family who also live in Waterbury a few days ago. 4 of them went on the trip. All of them are in home quarantine. The other 3 family members are now being tested.
It's here, it's real, and if you don't practice the social distancing, which we're told is the most important thing, that you're going to get sick.
The mayor has canceled multiple events in the city, including one today to celebrate St. Patrick's Day. While city halls are public buildings, in Waterbury, they are ramping up efforts.
We're probably going to do a little bit more self-policing of our public buildings, including this is City Hall, obviously. As you know, a lot of cities have closed City Hall. We might ramp up to that in the very near future.
And the city is looking for volunteers with experience in health care to help with their emergency operations center, also pass out meals for schools and Meals on Wheels. Now, if you need assistance or are interested in that, just call 311. That's 311 in the city of Waterbury. They say they've already fielded more than 150 calls in the past 24 hours. We're live at the mobile newsroom tonight. Courtney Zeller, Channel 3 Eyewitness News.
Okay, Courtney, thank you. The coronavirus is having a huge impact on businesses. Sales have been dropping off for a couple of weeks, but now that some are forced to close, they may need some help. Our chief Capitol reporter, Susan Raff, is live in Southington now at a florist where things have become pretty uncertain there. Susan?
Dennis, they certainly have. Nyron's Florist has been in business since 1931. They are not, however, one of the businesses that needs to be closed or are being forced to close, but business is definitely suffering, but there is help. They're still making arrangements at Nyron's Florist in Southington, but business isn't good.
So far it's been okay. It's definitely decreased.
In the last few days, several large events have either been postponed or canceled. 3 weddings and now a funeral. Paul has 2 full-time employees and 4 part-time. If business continues to drop, it will be hard to pay everyone. The impact the coronavirus is having on the economy could be devastating if businesses can't survive.
This is an unprecedented shock in demand. You've really seen many parts of the real economy just stop.
David Lehman is the commissioner for the Department of Economic Development. He says the immediate focus must be on health, but we must also help businesses.
The governor petitioned the federal government to declare Connecticut a disaster as it relates to being eligible for loans from the federal government. We received that declaration yesterday.
$2 million is now available from the Small Business Administration. Interest rates are anywhere between 2 3/4% and 3 3/4%. The state has also extended deadlines for the entity tax and the corporate tax, and there's unemployment insurance. But if this lasts several weeks or even months, Paul may need help.
I can last a little while. I mean, I have reserves. You know, I can borrow. My bank guy sent me something about the SBA giving some guaranteed loans. Of course, you got to pay them back. It's going to put you in the hole, but you do what you got to do. You know.
Never seen anything like it.
No. It's scary. I mean, the virus I'm concerned about a little bit, but I'm more concerned financially.
Employees all over the state are also feeling the pinch, and many of them are filing for unemployment. In fact, 10,000 claims. have been filed in the past few days. Coming up on Eyewitness News at 6, schools in Connecticut may be closed, but meals are ready for pickup. We're live in Southington. Susan Raff, Channel 3 Eyewitness News.